Now let's talk about acute pancreatitis. Acute pancreatitis is one of the important differential diagnoses if the patient presented with epigastric pain, and usually serum lipase and amylase will be more than 3 times the normal value. Ultrasonography findings may also help to support the diagnosis. However, CT is more sensitive than ultrasound, so we will discuss some specific ultrasonographic findings in acute pancreatitis. So here in this image, we can see this is the normal pancreas. This is the left lobe of liver. This homogeneous hyperechoic structure is the pancreas. So we can see the echogenicity of this pancreas is hyperechoic than the surrounding liver. But in this image, this is the image of the acute pancreatitis. The pancreas is swollen. Pancreas is enlarged in size. And if we compare the echogenicity of this part of pancreas with liver, we can see this part of pancreas is hypoechoic than liver. Remember friends, normally the pancreas should be hyper or isoechoic than that of liver. But if the pancreas is hypoechoic than that of liver, then we have to suspect acute pancreatitis. However, there are certain conditions in which pancreatic echogenicity can be lower than that of liver. For example, if the patient has fatty liver, then the echogenicity of the liver will be quite high. In that situation, if we compare the echogenicity of the liver with pancreas, then definitely pancreas will be hypoechoic. So this is called pseudo-pancreatitis. But generally, if we see hypoechoic pancreas than that of liver, then this is the finding of acute pancreatitis. So another image we can see there is heterogeneous pancreas. Normally pancreas is homogeneous like this, but here in this image pancreas is heterogeneous. Hypoechoic, heterogeneous with peripancreatic fluid collection. Here is another image. The pancreas is enlarged and here is some small amount of the fluid collection near the peripancreatic area. So here is another image. In this image, we can see this is the splenic vein. This is the splenic vein. If we see inside the lumen of this splenic vein, here is some hyperechoic structure. So friends, this is splenic venous thrombosis. So splenic venous thrombosis is also common in acute pancreatitis. And we can see there is some inflammatory changes near this basin. So perivascular inflammatory changes or sometimes actual thrombosis can develop in acute pancreatitis. To summarize all of these findings, the pancreas is usually swollen with heterogeneous echotexture. Enlarged pancreas with heterogeneous echotexture. Another is hypoechoic than liver. Another is peripancreatic fluid collection. Another is venous thrombosis. So these 4 are very important findings in acute pancreatitis in ultrasound. Sometimes if the etiology is gallstone, then we can visualize the gallstone inside the gallbladder or sometimes in common bile duct. So friends, I try my best to explain normal pancreatic ultrasound and ultrasonographic findings of the acute pancreatitis in this video. If you want to support my work, then you can share my video with your friends, you can subscribe, you can like, you can comment on my video.